Discover the shocking truth in this episode of where we're pulling back the curtain on the 1% of strategies that can change breast cancer screening, diagnosis, and even treatment. We're going to expose the gaps that are in the standard guidelines and show technical advances that most doctors and clinics don't even use. And we're going to share evidence that could keep you out of breast cancer by the grace of God, or even help you enhance your treatment if you have breast cancer. So we're going to talk about this in a different way. We're going to go into what's called signals, different layers, which makes a big difference in screening. Think of a combo. Most practices don't offer this in this method, but this makes a big difference. So imagine using a blood-based multi-cancer early detection. That means you just draw simple blood and you get 50 plus cancers. You can look at ctDNA, RNA, of course, breast cancer's in there, methylation patterns. And this is so important because you're not just screening for breast cancer, but if breast cancer's there, we will start to see the early signals. We've seen this in studies like Pathfinder, which showed in their reports, this multi-cancer early detection layers are getting so much better and highly specific. So this is the first layer of testing. We can save somebody's life and even help them have long-term remission. But we do this in a layered platform. So when we see any kind of signals that show that cancer might be there, now we can run other tests like circulating tumor cells and of course imaging with MRI, and we can get right down to the cancer. So this is huge. So this is all about layering your testing so you get early detection. And now what would be the second signal? So now we're talking about imaging, and everybody knows about the mammogram, but really what I like is QT breast ultrasound that help us to look at the breast with an ultrasound for even dense tissue. So why is that important? Because a lot of women have dense tissue. They have maybe a cyst and other things going on, and we can read this with that image. And when you combine that with getting a baseline, so you can see where the breast tissue is in baseline, look for any lesions, any changes, and then look at it every couple of years, depending on your risk. If you, let's say, have a genetic breast cancer risk in the family, you can do it the routine testing more like annually. But this is better in that sense because now if we see something in the QT breast ultrasound, plus we have this early detection multi-cancer test that shows breast cancer is there, we've got something. And we haven't done really any biopsy or anything at this point, but we know it's there. And it's usually going to be really small. And when we know it's there's a lot we can do. Now, the reason we're layering, because mammography alone produces false positive. Women who've done these tests, they're going to see about 10% get false positives. That means you're sent back to the doctor, you're scared, you think you actually have breast cancer, and you in fact may not. So I like this multi-signal approach because we can look at blood, we can look at imaging, and it's really easy. And we can look for more than one cancer. We can look for all the top cancers, which is brilliant because that's the key, early detection. We can remove the anxiety and the fear, we can spot it early, and then we can get into precision treatment where we can avoid oftentimes surgery and other procedures if we catch it early enough. So from there, we would escalate that positive test to an MRI, and then that's when the biopsy comes in. But if we know it's really small, we can take a little bit of the tumor information at the same time kill it with freezing the tumor. You heard me right, no surgery, just freezing it, especially if it's at the right size. We can cryoablate that tumor and get rid of it. You can do this type of target testing and screening when you have doctors that understand how to use this technology, but you're not seeing that because your oncologists aren't running these tests. They're usually not involved in screenings. Your gynecologists aren't running this. They're sending you out for mammograms to get baselines. The reality is with this type of testing, you can look for 50 plus cancers, have these data points, and you can then get into treatment with precision. In fact, this is what insurance plans should be offering if they want to remove and get rid of cancers. But they don't, and that's because they're not interested in getting rid of cancer. They actually make more money as premiums go up and care gets more expensive. And that's unfortunate because they have the wrong incentives. And the bottom line here is multi-cancer early detection methods are really effective when you combine these. So if you notice, I didn't say go get a full body MRI, don't do all this other stuff. Just use simple signals. You do a blood test, look for 50 plus cancers, do imaging of the breast. I like this QT breast ultrasound. It's amazing technology, gives you incredible visualization. It's so comfortable. The breast tissue goes into warm water and the image is just taken around. It's very clean. It's almost like a spa experience, not like a mammogram where your breast tissue is getting squeezed and you're getting radiation to the breast. So you get to avoid a lot of that. And then we can avoid surgery. So how do we do it? We freeze it. You heard me right. This is called cryoablation. And this fantastic technology we have, if you catch it early, you may not need any surgical removal because even surgical removal sometimes has a risk of spreading or inflammation. It's low, but it's there. And for very small tumors, just as a quick treatment, maybe 45 minutes, you can grab a little bit of the biopsy, freeze it, destroy the tumor. Now, the reason I like cryoablation when possible is because it keeps the immune system intact. And when you look at the 5-year survival data, it's really on par with getting the tumor removed and freezing it is almost identical. We're talking about like a 0.5 percentage point difference, which is irrelevant because I'm about to go into how you monitor long-term remission. So it compares really well well. And especially if you don't need to remove other nodes or do other surgical resection because you've caught it early, this becomes a really great way to avoid the lumpectomy, mastectomy, or breast reconstruction that is really oftentimes unnecessary. So I love the use of cryoablation when used correctly. We've used it for years and it works very effectively. Now, once we've done that, we freeze the tumor and we know the tumor's dead, but we've kept the immune system so the body can recognize other cancer cells. Those antigens are present. We didn't remove them. Now the immune system can grab that information and work. Cryo leaves these antigens. This is the fingerprint around the tumor so the immune system can recognize it through priming. Now we continue to monitor with CT, circulating tumor cells. We monitor this regularly. And instead of waiting for lumps or tumors or imaging to give us data, we can track it really easily. If those numbers stay nice and low, we're great. We're holding remission. If they want to go up, we're seeing it at a cellular level before it becomes a tumor. And now we can enact treatments to knock down those cells so they never become tumors. This is the 1%. This is how you eliminate breast cancer, really a lot of cancers out of your life by using these technologies. So we can independently predict disease, free and overall survival in this very early breast cancer monitoring. Because if we have a negative ctDNA and CTC after it's been removed, there's so much of a low chance for relapse, which is exactly what we want. And we can now focus on metabolic factors, immune system, infections, chemical toxins, heavy metals, any of these causative agents with root cause analysis. We can also build the immune system. And by the way, when you do those things, you're also reducing risk for heart disease, diabetes, Alzheimer's, because these same heavy metals, chemical toxins, infections, metabolic problems with poor diet, inflammation are linked to heart disease, diabetes, cancer. So in this section, I want to talk about genetic tests for breast cancer. Most breast cancers are not caused by your own genetics. Some are, very few, maybe 2-3%. But you can do an early detection. So if you've had breast cancer in the family, you can run the hereditary cancer screener. And it's a one-time, and you run them once for your entire life. And you know if you have a pre-existing condition to these tumors. If one of these tests comes back positive, it's really important because your monitoring will be a little bit tighter. So every year you'll be looking for this. And then when you find it, or hope you don't get it, but let's say you do and you find it, it's a quick treatment to remove it with the same process I just went over. No need for lumpectomies, double mastectomies like we saw with Angelina Jolie. Poor thing had to do all this surgery, reconstruction. With today's technology, it's not needed. We can spot it, stay on top of it before it becomes dangerous, and we can do it really easily. These genetic breast cancer tests are also good to have if you have a family history of that or other cancers as well, like pancreatic, colon. I would still run these tests. Most gynecologists refer out for a biopsy, and oncologists will, get that data once it's proven to be cancerous. They get referred to oncology, and then from there begins. It could be surgical referral, it could be IV chemotherapy, but there's really a lot missing in between there. So it's really important that if you get to that stage, now we need to move to precision targeting. So we know there's a tumor, we know it's spread, it's a little large, it might be involved in lymph nodes. It's not a simple freeze, change diet and lifestyle and monitor. Now we want to get into knowing all the targets for the breast cancer. So we run precision targeting. We run DNA, RNA, immune profiling, and spatial biology so we can see all the targets and treat them. So this is unusual because in the standard care model, you get none of that. You get a tumor marker, a biopsy, and imaging, and then they start treatment without having all this data. And the reason this data is important is because we can be real precise with therapy. Again, we can go micro dose. You don't have to lose your hair, get a nice tumor eradication. And the most important part is the immune system. If you think about this, your immune system can basically kill the cancer all on its own, but you need to target that immune system to that tumor. And that's not happening. And there isn't many drugs on the market for breast cancer, and you wouldn't even be a candidate until the cancer was advanced. One of the advantages of precision oncology is you get immunotherapy involved early, and this is going to help with the treatment of the breast cancer. So think of it that way. It's like getting a full blueprint of the exact immunotherapy strategies you need for your body. And you're incorporating them day one because the immune system is the key to long-term remission. Doesn't matter where you are in the spectrum of even preventing breast cancer or you have advanced breast cancer, the immune system is the key. And oftentimes the treatments we have today, women with high risk, let's say triple negative breast cancers, will have access to some immunotherapy to help with overall survival, but it's still, in my clinical opinion, not as well as custom-built immunotherapy, which can be specific to the patient. So think of it this way, your cancer, your tumor is there and your immune system can kill it. So think there's a gang outside of your tumor blocking the police, your immune system, from getting to the tumor. So here, we clean up the neighborhood so the police can go in and kill the tumor. So it's really important. You look at immunocentric planning. So this helps the goal of achieving long-term remission for our patients is all about the immune system and immunotherapy-centric care. Now, we've done all that. We've got a patient who has better treatment planning. Now they can go microdose or direct to tumor, save their hair, go hiking, have a lot of energy, rebuilding their body with nutrients at the right timing and dosing, integrative agents to support their care. This is how you treat the actual breast cancer in my clinical experience, with a much better quality of life and long-term monitoring. Like, we go back to circulating tumor cells, methylation scores, and all these things we use. So before a tumor would ever come back, we would see it, be able to get on top of it, and prevent the tumor from happening. This is what less than 1% of doctors know and provide. Now, what do we do once we've done that? You're along that path. You want to either prevent the cancer, or you got rid of it in early stage and prevent it, or you're in remission right now. It's building that immune system. And so one of the key parts of that is removing the infections. Most cancers go undiagnosed as having infections because doctors don't test for them. And it's much higher than the global rates say. There's only 13% or 30%. It's much higher than that because patients aren't being tested for all viral, bacterial, fungal, and Lyme disease. A recent study now has shown what we've already known for years is Lyme disease is a new signal. In 24, there was a paper that came out where Borrelia, the DNA antigens, were found in breast cancer tissue and localized around malignant cells. So we've known this for a long time. Tick-borne illness or parasite, whatever it might be, these are depressing the immune system. They're knocking it down. Immune depression, evasion, and the immune system becomes weak, and all of a sudden tumors can grow uncontrolled. So we need to clean the body up of infections, all of them, mycotoxins, fungal, bacterial, viral, and then we need to clean it up of heavy metals, chemical toxins. And now we've got a plan to clean the body, build the immune system, give the body the nutrients it needs. See, this is often completely missed as everybody's just focused on diet, and it's a big part of it, but it's not the whole thing. Mitochondrial dysfunction, yes, can come from sugar, eating unhealthy diets, metabolic problems, but we need to look at infections, chemicals, and heavy metals. And when you have that all dialed in, now, in my clinical opinion, you have the best chance of holding or maintaining a remission with cancer. That's what we've seen clinically. So going back, if the cancer's small, we can avoid surgery, freeze it, cryoablate it. Very low risk, very easy to do. Repair the body's causative agents, clean it out, help the body to be healthy, infections, chemical toxins, and then monitor with ctDNA and CTCs for several years, keeping the immune system strong and holding long-term remission. Everything I'm talking to you today is about precision. This is how you elegantly target cancer without going through all the surgery, all the high-dose chemo, all the things that you're seeing out there that are scary. We don't need to do that anymore. We have technology now in this model that allows us to help patients heal and get to the cause of their cancer. So early detect, you can monitor, you can go into early remission, you can treat better. These are the approaches to breast cancer. We can now prevent breast cancer before it even starts. We can treat it correctly, and we can help women be well and healthy and blessed by the grace of God. I hope this was helpful. May the Lord bless you on your journey to healing.